And now we are joining us from Ibadan, the Oyo State capital, to speak on this issue of flooding and diseases associated with it. We have Professor Oyewale Tomori, Professor of Virology, Disease Prevention Control. Good evening and thank you so much for joining us on our news at this time.
Good evening, and how are you doing yourself?
Okay, all right. Now, straight to the questions. What do you think are the likely health implications on humans as well as health facilities as flooding recedes?
Yeah, I think, first of all, we've seen the effect of the flood itself. But what happens is that because of the stagnant water, it creates an environment for bacteria and viruses to remain. And remember also the fact that you have those bacterial infection pathogens and also viral pathogens. They become a source of infection, particularly diseases like diarrhea, gastrointestinal infection will be a common thing to watch out for. You also find that because of the stagnant water, there'll be breeding of mosquitoes and other things. You're likely to have increase in malaria. When you also remember that this flood has taken in a lot of chemicals and contaminants, that becomes a source of irritants to people on the skin and all of that. But I'm more particularly worried about the laboratories at the university where you have these. I was told at the University of Maiduguri, their labs were all flooded. And I'm worried particularly about the polio lab that is in place there. If we're not really careful, we need to do something quickly because of the viruses that may actually have been got into the flood, which remains stagnant somewhere. Also, bacterial infections and other things like that. Those are areas we need to watch out for.
Okay, all right. So apart from the flooding caused by excessive rainfall, now that the federal government has also given warning about Lagdo Dam release, there's no doubt that there would be worries that this would give room from some neglected tropical diseases to fester on residents of the affected community. What do you think the government can do to curtail that?
I think first and foremost, it's supposed to be, we need to alert disease surveillance for people to be out there monitoring what is happening. Any increase in number of these diseases I've listed, like malaria, like viral infections that may come because of the mosquitoes. Example, we have dengue, for example. We also have contamination from all sorts of things. So we need to improve our surveillance, monitor the people to find out if there are any increase in some of these diseases, skin infection, contamination, all those are factors that we need to look at. And once we do that, to quickly take action. And one of the things, the earlier we clear off the debris, the better. Providing good water supply to the people will be another approach that will help us in ensuring that we don't have these diseases that we're thinking about.
Okay, all right. So what would be your advice to the government of Nigeria in addressing this issue of flooding?
Well, the stories that I've come across is the fact that the rains are here and they're getting, well, these are some of the reasons why we have, when there's no place for the water to drain off, then, of course, you have flooding. And this comes from our gutters, our drainages are all blocked because they're not properly taken care of. People drop refuse everywhere. And of course, when the rain comes, it blocks up all the other things. And instead of there's nowhere for the water to go, it comes back into the houses. So we need to keep our environment there because otherwise the water will not be able to flow. Our gutters, our drainages, some of them are eyesores. And I think this is something we need to begin to think about now. Those that don't have flood now, begin to look at your area. Clear your gutter, clear your drainages so that you don't have the water overcoming and coming into your houses.
Okay, all right. We thank you so much for sharing your views with us on Galaxy TV News. We truly appreciate your presence.
Thank you very much. It was my pleasure.
All right, and that was Professor Oyewale, Professor of Virology, Disease Prevention and Control, who joined us live from Ibadan, your state capital.